Hello, everyone. My name is Lauren. I'm one of the educators here at Iris. I'm joined today by Corey. He is also an educator at Iris. And as you may already know, if you've been joining our webinars throughout the year, we are conducting these in conjunction with our newsletter just to provide some additional resources for our clients, offer you opportunities to connect with us, maybe outside of traditional training, ask questions, and address any obstacles or challenges that you're facing. Before we get started, just a few housekeeping items. Everyone is on mute, as is typical for our webinars, but we do have an option for you to submit questions. So if you go to the bottom of your Zoom screen, there's a Q&A button, and you can submit questions at any time using that button. Corey and I will do our best to address any questions that you raise today. If you have questions that are maybe a little bit more specific to your camera type or your organization, and maybe it makes more sense for us to connect with you separately, we will do that. So if your question is not addressed live here today on the session, I will follow up with you personally via email to make sure that we connect you with the resources that you need. So feel free to use that Q&A box at any time. And so we'll go ahead and move through our content. And then if you have questions, we can address them as we go or at the end of the session. Okay, before we get started, we just wanted to get a little bit of a sense of the workflow that those of you who are in attendance are using. So dilation techniques are, we have the option for natural dilation using a darkened room to facilitate natural pupil enlargement. We also have some organizations who offer the use of dilation drops when the patient has a small pupil. So we're just kind of curious to understand how many of you have dilation drops as an option and how many of you are just using natural dilation techniques. So I'm going to go ahead and launch that poll and we'll see what everybody answers. Just give a few minutes for everyone to answer that poll. All right. Closing the poll in 3, 2, 1. Okay, so unsurprisingly, the majority of you on the call do not have the option to use dilation drops when indicated. But at the same time, we do have several users that do have that option. So there's no right or wrong answer when it comes to this as an option. But I will say that dilation drops are an effective method to use when those drops are indicated, right? Some patients don't dilate very well naturally. It is helpful to have that as an option. So because everybody uses uses natural dilation techniques during the exam, we are going to discuss those first, but we will also talk about some of the best practices when using drops, since we have a few users on the call who have that as an option. Before we jump into that, let's talk about why dilation is important. So why does pupil size matter for this exam? Why do we care that the patient has a large pupil? So Corey, can you talk a little bit about what the pupil serves as during this exam?
So the pupil basically regulates the light that is basically focused on the retina. The retina is our target. That's where we're trying to take a picture of. So you definitely want the pupil as large and as large as possible. Think of like a window with a shade. You know, if the shade's all the way down, it's hard to see all the stuff inside, but if the shade's very easy to see everything. We always want that shade as open as possible so we can properly capture the anatomy that we need. So that's what the pupil, again, when you're at a beach, your pupil is really small. But if you are in, turn off your light in the middle of, turn off your light before you go to bed, you can't see anything in your room, but give yourself a few minutes and your pupil has enlarged and you can actually walk around your room without killing yourself. And so it's just it's your brain making you safe all the time. So it wants to dilate in a dark environment, and when it's bright, it's going to constrict. That's why we want to do this in a dark environment.
Absolutely. So like Corey mentioned, that window to the back of the eye through the pupil, that shows us the anatomy that we need to see. And we talk a lot about image quality when we're discussing training and best practices for conducting the exam, because it is so important to capture the most anatomy that we possibly can. And so when the pupil is large, we can see more of the back of the eye, which obviously has a clinical impact because we want the interpreting provider to see the anatomy necessary so that they can make a determination on whether pathology is present. And so, we can see on the left lots of shadows on these images because of the small pupil, and it is actually obstructing our view to some of the pathology that is present on those patients' retinas. So, dilation has an impact from a clinical standpoint in terms of illuminating that anatomy so the interpreting provider can identify disease. It also has an impact from a workflow standpoint, right? Bigger pupils are easier to take photos of, especially if you're leveraging a handheld device, because that is a manual process. So, again, the bigger the pupil, the better from a clinical standpoint and also from a camera operator workflow standpoint. So, one of the things that Corey and I always like to talk about is kind of best practices for workflow, because we often see people taking steps that aren't required or necessary or even that helpful when it comes to natural dilation techniques. So, one of the biggest myths we see is camera operators think that a patient has to sit in a dark room for an extended period of time before they even try to take photos. And we're happy to report that that is not the case. Most of your patients are going to dilate pretty quickly as soon as you get those lights turned off. So, Corey, how would you conduct an exam to maximize natural dilation while minimizing the time taking?
Yeah, so what my preferred method and what I like to train everybody is I like them to honestly have the light in the room turned off and maybe have the door open and using the light from the hallway, making sure the patient is comfortable and can get sat down. As soon as they walk into that room, your pupils are going to start being affected by that darkness. Now, whenever the patient is sitting to the chair, you may, if you have a tabletop, get them set up in the tabletop, and then once they're all set up, have them sit back, or if you have the handheld, you may be getting that handheld ready. But this is where I like to shut the door and say, hey, patient, I'm going to make it really dark in here. And then I just like to explain three things. I'm explaining what I'm doing, why I'm doing it, and how I'm doing it. I'm doing this in a dark room because I'm buying dilation time, but I'm also doubling up because I'm explaining the process and explaining what's going on to make that patient more comfortable and aware of what we're doing. So the three things I like to say is what I'm doing, why I'm doing it, and how I'm doing it, but talking about this in a dark room. So what are we doing? We're just checking your eyes to see if diabetes has affected your eye health. Why? Did you know the number one cause of blindness in the US is diabetes, and it's preventable just by taking these photos? We can make sure it's not affecting you, or if it has, we can get you the help you need earlier rather than later. And then, then how? So I'm going to get, if it's a handheld, I'm going to get up close and personal. I might start with your right arm, lightly touch your temple, land the camera. You're going to be looking for that fixation dot. Same thing kind of with the desktop, but the camera does a lot of that work for you. So you're going to get the patient sat back up into the desktop, and you're going to be describing what they need to look at, and then you're going to start the exam so that they know where the fixation is. But those are the three things that I explained, and then pretty much I can get started right away. So I'm going to take a minute or two talking to them in the dark room and then start the exam. For all intents and purposes, this whole exam can be done in less than 5 minutes, easily.
Definitely, definitely. So, like Corey said, leverage that dark room as soon as possible. The quicker that you can get their eyes dilating, the better. This also allows your eyes to adjust to the darkened room. If you happen to be an operator who's going into patient homes, the same principle applies, right? You're gonna want to darken that environment as much as you can. Obviously, you do have a little bit less control over those circumstances than someone who's in a primary care facility would. But you are able to, face the patient away from the window. If they've got shades, you can close that window. You can have the patient close their eyes so that their eyes are dilating using, kind of that darkness from having their eyes closed. So any steps you can take while you're explaining the exam and preparing the patient are going to be beneficial.
One thing I do want to add is whenever you are in that dark room and you've kind of explained something and you want to get started, you can do yourself a favor, crack the door a little bit, get yourself some ambient light because we're just trying to shock the eye so those pupils dilate first, and then you potentially can crack the door a little bit just so you feel more comfortable and you're going to be able to address the patient, especially in handheld because you are really kind of close. A desktop, you may not need that function as much, but if you're in a very dark room and you're not feeling comfortable being able to see the patient, crack your door a little bit, right? And then make it a little bit easier.
Absolutely. You can also leverage a red night light. A lot of our clients, those are available for purchase on Amazon. So you can use a red night light to help illuminate the room a little bit as well, so that you have some ambient light. Red light is the least impactful to dilation, so that's one of the reasons we recommend that as well. A few other steps to take, right? So you turned off the light. You've explained the exam to the patient. You've cleaned the equipment. You've made the necessary adjustments given the camera that you're using, whether it's logging into a handheld device or adjusting the camera so that the patient can get into it if you're using a tabletop. When you begin the image capture process, you are going to be able to evaluate that patient's pupil size. So your camera is either going to show you their pupil so you can see how big it is, or it's going to display a number, right, when you begin the image capture process that tells you how big the patient's pupils are in millimeters. And that's going to be those tabletop cameras that offer that number. So leverage your camera's information, right? If your camera shows you their pupil size when you first begin the image capture process, if you can see their pupil, you should know, right? Especially the more that you begin taking photos and performing this exam, you should be able to very quickly identify this patient has a big pupil and image capture process is going to be easy, or this patient has a small pupil and the image capture process is going to be a little bit more challenging. If you've got one of those tabletop cameras that tells you the pupil size in millimeters, as you're beginning that image capture process and you identify that they're below that setting, right? We're looking for 2.8 or above, then you can take additional steps to try to address that pupil size from a natural dilation standpoint. So when you're taking photos, the camera flashes the light in the patient's eye, right? That does impact dilation. So if you identify that the patient has a smaller pupil, I would recommend taking a little bit more time during the image capture process. If you have to take more than one photo, I don't recommend taking those photos very quickly, one right after the other, right? Take a photo of one eye, allow that patient to take a moment, allow their eyes to re-dilate for a few seconds before you move to the other eye or before you try to take additional photos. This is especially true if you're using a handheld device. You can move between eyes, right? So sometimes if I'm using a handheld camera and a patient has small pupils, I'll take a photo of the right eye and then I'll move to the left eye and then I'll come back to the right eye. If your tabletop camera has a delay between the eyes, do not bypass that delay. This is something Corey and I see all the time. We'll get a perfect picture of the right eye, but then the camera operator did not allow for that delay when the tabletop camera was moving from the right eye to the left eye. And because they hit the continue button and they bypassed that delay, that pupil size is a lot smaller for the left eye because it hasn't yet adjusted from the flash of the right eye being imaged. So these small little steps that you take during image capture can go a lot farther than having a patient sit in the dark for 5 or 10 minutes and then taking a bunch of pictures in a row. Just take that little extra time when it's indicated. And again, if you identify that the patient has big pupils, you're good, right? You're in paradise. You're in happy land. Yeah, take those pictures and move on. All right. I think that covers everything we wanted to discuss there. And again, just as a reminder, you do have that Q&A box at the bottom of your screen if you want to ask us any questions during the session. Okay, so when you're using natural dilation techniques, there comes a point where the patient's pupils have dilated as much as they're going to, right? There's not a way to get their pupils to dilate more. And so sometimes we run into operators who question whether they should upload those images, even if they're not ideal. And so, Corey, can you kind of talk about why we recommend that they go ahead and upload the best photos they can capture?
Yeah, because a majority of the time, we're always looking for 4 parts of anatomy per eye. Again, if you're missing one, the grader can say there's not enough information, so that's a possibility. But even due to certain dilation, that we may not get all 4 parts of each eye. Now, the likelihood of it being gradable is slim, but there's still a chance. And that chance is if they find pathology in the patient's part of the eye they can see, you literally could have just one part of anatomy in one eye and zero in the other. But if you uploaded that and that one part they see pathology, you just saved that patient's eyesight. It is not like your diabetics are going to get this every 6 weeks. We're lucky if they do it once a year. I bet if you ask your patients, some of your patients that you haven't done it before on, I bet they haven't done it in 5 years, or maybe even never done it, or what have you. So it's not like diabetics are doing this all the time. And as me, I'm diabetic, so I want to do this once a year, if not more. I know I get my photo taken every day, but it's like, so I see any changes in my eyes, but as a diabetic, they don't realize how important this is, and they don't realize their eyesight is taking their eyesight until it's too late. When they realize it, they're on the wrong side of this whole endeavor. So every time, every chance you take, you have a chance of saving someone's eyesight. So I don't really I'm not a fan of you deleting images that have anatomy because you never know what the grader can see. There's no such thing to me as a bad image because non-gradables, yes, they happen. I'm not perfect. Lauren's not perfect. We have taken non-gradables, and we teach you how to not take them because we know better, right? But we also know that small pupils are really our kryptonite. That's the thing that we will always, everyone will struggle with small pupils. Even if you administer dilation drops, those sometimes certain medications that will constrict the pupil, the dilation drops, they counteract each other and they don't work. So it's still a possibility even with drops, but it's really about providing the grader with all the information you can. You are just using the tool, and it's just a tool. You're smarter than the tool. You may know that it 100% might not be gradable, but you want to take that shot. Always take that shot, because if you don't take that shot, you never have a chance of winning.
Absolutely. Absolutely. So 100% gradability should not be the goal. There's going to be times where you cannot capture ideal images because of something that's beyond your control. Pupil size is beyond your control, right? So our job is to get the best photos we can, showing the most anatomy. For the handheld devices, you are able to send multiple images to Iris per eye. So you can use that to your advantage to try to show different parts of anatomy in those images, right? Tabletop cameras, it's a little more challenging because it's typically only one image per eye, but we still do advocate for you to take the best photo you can and upload it to Iris. And one of the reasons we advocate for that is, like Corey said, there are parts of anatomy that are visible. If those visible parts of anatomy show pathology, then the interpreting provider can indicate that. And so this is a real image that Iris received. If you're in a room with bright lights, you may not be able to see the image very well. It is quite dark. Yes, absolutely. So if you have the option to turn the light off in your room while you're viewing the webinar, you can do that and try to see this a little bit better. But this is a real image Iris received from a tabletop camera where the patient had extremely small pupils. But this patient also had proliferative eye disease. And so the interpreting provider was able to indicate that on the patient's result. And so this is one of the reasons that we do advocate for uploading the best photos you can. It's not likely the camera operator who uploaded this photo thought the provider would be able to interpret it. But again, we are not able to be the decider, right? The only person who can say whether they see eye disease in the photo is the interpreting provider. And so it is helpful to go ahead and do the best we can so that we give the patient the best chance possible to get an accurate result. All right. And again, just a reminder for those of you who've just joined us, if you have questions, you can submit them in the Q&A box at the bottom of your screen. Okay. One of the other common misconceptions that we hear is that contact lenses interfere with the exam. They do not. Your patients do not have to remove contact lenses if you are using natural dilation techniques. You will not see any evidence that your patients are wearing contacts during the exam. The only time that contact lenses become a factor and need to be removed is if you are administering dilation drops. And that's simply so the solution can make contact with the patient's eye. Once you've administered the drops, the patient can reinsert their contact lenses. So don't be worried about that as a factor with those natural dilation techniques.
That also goes for colored contact lenses because normally they have a color surrounding it, but there's a clear middle where your pupil and where your camera can focus on. So it's not going to see the color. It's not going to affect the image. So they never have to remove the contacts with the exception of administering dilation drugs.
Absolutely. So that, the pupil's not obstructed, so it's not blocking anything. So just to recap, for natural dilation techniques, turn that light off as soon as possible. Make the environment dark as soon as possible, as Corey just demonstrated, right? The darker the environment, the better. Anything that you can do to increase that patient's pupil size is going to be beneficial. And again, if you're going into patient homes, right, the same thing applies. If you can face them away from a window, if you can get those window shades closed, the darker that you can make that environment, the better. If you have the patient close their eyes, that can assist with dilation. Anything that you can do, right, to make that environment just a little bit darker at the beginning while you're explaining the exam and cleaning the equipment, that's going to facilitate that dilation. If you identify that the patient has big pupils, you're good to go, right? Take those photos and move on. Yep. The exam can be very, very quick when your patients dilate quickly, which is going to be a good portion of patients, right? Sometimes it's a little bit of the luck of the draw. I've definitely had days where it feels like every patient in front of me has small pupils. So that definitely does happen sometimes. But again, we want to assess the patient's pupil size as quickly as possible, because if they have large pupils, we're good to go. And then if they have small pupils, again, it is so much more effective to just take a little bit more time to perform the exam, right? Give a little bit more time in between the photos that you're capturing to allow their eyes to redilate. Allow, if you've got that tabletop camera, allow for that delay between the right eye and the left eye so that patient's eyes can redilate and readjust after the flash. Handheld cameras, you can move back and forth between eyes. You can have the patient sit back and close their eyes for a few moments. I'm not advocating for an extended period of time, but just taking those little tiny incremental steps during image capture can go a lot longer. It can go a lot further in helping that patient adjust than just throwing them in a dark room for 5 or 10 minutes and then trying to take a bunch of pictures in a row.
And handhelds, remember, you can take more than one photo. So you can take multiple photos. So if you only capture 2 parts, we just got to capture the other 2 that's missing to complete that anatomy. So even if you have a smaller pupil and you capture 2 parts, your next photo, try to capture the other 2 to complete that anatomy, and the grader can grade that for the handhelds.
Absolutely. All right. So we've got a question about hard lenses. I think the user might be asking about like an intraocular lens or a lens that's been surgically placed in the patient's eye.
Could be hard contacts.
Or could be hard contacts. Okay, so let's address both. Hard contact lenses don't need to be removed, won't interfere with the exam. You won't see any evidence that your patient's wearing them. Any contact lenses they're wearing that they insert to see, right? Now, if your patient has an intraocular lens, right? Maybe they've had cataract surgery and a lens has been surgically placed in their eye, you may sometimes see like a rainbow or a halo effect on the images that you capture. This is a lot more common when you are capturing photos with a handheld device. This is not a contraindication. There's no reason not to perform the exam if they do have an intraocular lens, but it is something to be mindful of during image capture. You may find that that's a circumstance where you capture more than one image to show a comprehensive view of anatomy.
And just remember, whenever you do have, sometimes in the infrared for handheld operators, you may see sometimes a weird light reflection, and that's the infrared refracting off the curvature of the lens. you really have to kind of just move through that additional light noise to get to the back of the eye because you're basically just getting to a point where you kind of push that off all to the side. Now, when you capture that photo, that white light can create that rainbow effect. I always say treat it like a shadow. If it's blocking part of anatomy, I want you to take another one. A slight angle adjustment movement will move that rainbow to a different part. But if it's not blocking anatomy, I'm not concerned with it. But it's most of the time it's just you might be a little too far away and you need to move in a little closer to get rid of that kind of rainbow or that light refraction in the infrared.
Absolutely. So again, doesn't prevent you from performing the exam, but you may need to make some accommodations if your patient has that intraocular lens. All right, so we do have a few more questions that we're going to address, but before I do that, I do want to just briefly speak on dilation drops if your organization allows for you to use those when indicated. So I want to preface this by saying that every organization creates their own protocol around dilation drops. Some organizations have a questionnaire or a consent form that they want the patient to sign before drops are administered. So it is very important for you to understand what your organization wants you to do when you are leveraging dilation drops if they are indicated. So Iris does not set that protocol. That's something that's going to be specific to your organization, right? What we can speak to you about very generally is kind of best practices for administering the drops and also kind of dispel some of the myths around the drops. So the first thing I want to say is that these dilation drops that you're using are not the same as what's being leveraged in eye care facilities. So a lot of times when we talk about dilation drops, the people that we're training are kind of picturing the last time they went to the eye doctor, right? Your eye doctor's job is to get your pupils very, very large, right? They want to see a lot bigger of the back of the eye than what we are trying to see. We're just trying to get, a little bit of a boost. So the tropicamide solution that we recommend, that most of our clients are using is a 0.5% solution. This is the weakest solution of tropicamide available. It's very fast acting and it's fast to wear off. Many of the patients I've seen dilated with this solution don't even really notice their eyes have been dilated because we're not giving them that same level of dilation that they would receive at the eye doctor. So it's a very small dose. We're just, again, trying to get a few millimeters so that we can see just a little bit more of the back of the eye. So it's not the same strength. The other thing that I like to talk about, is the tropicamide drops are pretty easy to administer once you get used to it. We do have a video on administering drops. Sometimes it's a little bit challenging because that's not something that, you're necessarily used to doing in your day-to-day. In our video, we talk about some of the best practices. It can be helpful to have the patient tilt their head back. And then you could stand on one side of the patient. So if Corey was my patient and I was administering drops, I would have him tilt his head back. And then I would have him look the other way from where I'm standing, right? And then I would just pull down on the bottom lid to create a pocket. And then I could administer the drops into that pocket. And then I would actually come over to the other side of Corey. He would look the opposite way, and I would repeat that process. You can give them a tissue, to dab at their eyes. We don't want them to rub really hard in their eyes, but we do, they can dab. There might be a little bit of tears when you administer the drops. That's totally normal. Some patients experience a slight stinging sensation that does dissipate pretty quickly, but that is also normal. So this is, something that you can leverage when indicated. And like we talked about earlier, if you have this option, it is very beneficial because there are patients who don't dilate well naturally. And if you have this tool at your disposal, it can be really effective in terms of getting those pupils larger so that you can see more of the anatomy. And again, that does have that clinical impact of illuminating the parts of anatomy that may or may not have pathology that's visible. So really, really helpful tool if you have it at your disposal.
Pro tip for the dilation clinics. If you have a patient and you did dilation, you had to do dilation drops on it, put it in their notes of their chart so that when the next time they come in, as soon as oh, hey, this patient's coming in, we had to do dilation drops last year. just as soon as they come in the door, bring them in, do dilation drops. They can go back, sit back in the waiting room. They can go see the provider, do labs, do whatever. When they come back to you, they're gonna be nice and dilated. We're just gonna knock this out real quick and get you going. That makes the exam even more efficient for you. So if you know they had to have dilation drops last time and you have them coming in, just grab them and do the drops real fast, and then they can do everything else at the clinic, come right back to you, and their pupils will be nice and big for you.
Absolutely. So that leads me to the last part, which is, as Corey said, those drops do take a few minutes to take effect, about 5 to 10 minutes. So when you administer the drops, you are going to have that patient sit for a little while so those drops can take effect. If you're performing the exam at the beginning of their visit, like Corey said, they can go see the provider. You can have them sit in the waiting room for a few minutes. They can play on their phone or read a book, hang out, and then you can bring them back to perform the exam. So when you use those dilation drops, they don't have to sit in a dark room while those take effect. They can, but you do want to have them sit for that 5 to 10 minute period so that the drops can actually go to work and dilate their eyes. And again, as we mentioned earlier, if you have a patient that requires drops and they happen to be wearing contact lenses, you do want to have them remove those contact lenses before you administer the drops, so that the solution can make contact with their eyes. And then they can put those contact lenses back in once you're finished administering the drops. Okay, so a couple of specific questions on dilation. The one of the questions has to do with medication or smoking, different factors that can impact dilation. And so one of the things I'll just say is every person is different. We unfortunately can't really give you a list of hard and fast, these patients will have small pupils, these patients will have big pupils, because everybody's different. And so while there are some things that can impact dilation, there's really not a way to know for sure until you try to perform the exam. So we don't really have a list of medications or anything like that you might stray away from. To be honest with you, we're always going to advocate for you to try to perform the exam. So even knowing these things ahead of time wouldn't necessarily help you, because at the end of the day, you're just going to want to try. Hold that camera up or get that patient positioned and just try to take the photos and kind of see what you're working with. That's going to be a lot more beneficial to you because you're going to be able to know for sure, right, how big that patient's pupils are.
Yeah, I had a patient the other day who was 88 years old, hadn't had the biggest pupils I've seen. So I mean, age doesn't matter, ethnicity doesn't matter. None of these things do. It's just like naturally how that patient is. I always kind of describe, like, think of a farmer who works outside all day. Well, their pupils are probably going to be a little bit smaller than somebody who works in an office all day. So those are just people. It's like natural what they do, and everybody's pupil is going to be a different size. Again, maybe some smokers, their pupils will be a little bit smaller, but it's not. I want you to try and take every photo you can. I don't want you to be like, oh, that's a smoker, I don't want to do that one. It's
right.
like
There's no hard and fast rules.
Nope.
Yeah, absolutely. Absolutely. Another question regarding using dark eye masks for dilation. So this might be something that some of our in-home users are doing. I know some people who are doing exams in patient homes will have them wear sunglasses during the beginning of the visit before the exam is performed to kind of begin that dilation process. So we don't have any hard and fast data on how effective it is, but anything that you can do is going to be helpful.
Any darkness helps you, especially you in-home operators, because you're walking into an uncontrolled environment. You don't know what your environment's going to be like. But that patient may be like, I don't want you to come to my house. Well, let's go find a shady spot over here under the tree and do the best we can. Because these cameras, you could even take it in the middle. Like, I know I could capture Lauren's eyes right now in the middle of this light. It wouldn't be a problem. We could do it because you know what you're looking for. But dilation, the darkness helps. That makes your job easier. So that's why we always want to do it the best we can. But I mean, I've said, hey, if you know you're going to your patient, ask, and you can call them if you're going in home, and you can call them before, hey, I'm gonna be there in 10 minutes. Hey, can you turn the lights out in your room, and we can come in, and then we can kind of get started with this first, set that stage, get that dilation happening. If they have a towel, just like, fold it over their eyes, and just, again, you're just blocking any light, because then your pupils are wanting to think it's dark and it's trying to make you safe, so it's going to dilate. Anything you can do to help make your job easier, please do.
Absolutely. Another question asking if there is an age restriction when administering dilation drops. So again, I would tell you to consult your organization's workflow dilation protocol. Most of our clients, the vast majority, are performing this exam for patients who are 18 and older. So I would definitely just make sure that you have a good understanding of your organization's direction in terms of the population that you're targeting, and make sure that you know what they want you to do. But I don't know of any age restriction on using the tropicamide. So, but again, this is something that we always advocate for you to have a good understanding of what your organization's protocol is. So, but if you're doing this exam for patients who are 18 and older, I don't believe there's an age restriction. I've not heard of any of our clients, that have imposed an age limit on dilation drops. So.
The only one I've ever heard is like they were automatically administering dilation drops for 65 and older. Automatic. That's what their policy was. So I told them that wasn't really necessary, but again, it's whatever their policy, that's what they're going to go by.
All right. Question on how long the dilation drops last. So the effect of the tropicamide 0.5% lasts for about 2 hours. But again, it's a very mild solution. Most organizations that we're partnered with who use dilation drops don't have a restriction on whether the patient can drive afterward because it's not a significant impact to their light sensitivity. So again, that is going to be specific to your organization. But again, most of the clients who I know of that are leveraging dilation drops when indicated, they don't have any sort of restriction on the patient driving afterwards. So
Yeah, the goal of the dilation drops is just to open it up to what naturally dilated we would have. So like if you went from a dark room to a bright room, it's a little brighter, and that's kind of what their experience is. Just with the dilation drops, it's just that medication's kind of trying to force those eyes to keep them nice and dilated for you.
absolutely. We've got a question, not necessarily related to dilation, but it is related to a tabletop workflow. And I'm going to go ahead and answer it live just in case anybody else is running into this issue. But this user is asking, what do we recommend when they're trying to capture an image with a tabletop camera and the camera is not able to find the patient's eye? So this is something we see a lot with tabletop cameras that have not been turned off in a really long time. So tabletop devices don't need to be powered down every single day. We do recommend about once a week. So if you are using a tabletop camera and your organization is maybe closed on the weekends, a lot of our clinics, they'll go turn the tabletop camera off that Friday afternoon and then come turn it back on that Monday morning. So that's one thing that we can usually identify as an opportunity. A few other things can impact the camera's ability to find the patient. Patient positioning is a big one. If your patient is not touching that chin rest with their chin, if they're not firmly down on that chin rest, if they're moving at all. Also, if their forehead is not touching that forehead bar, if their face isn't flat, using those 2 points of contact, that's going to impact the camera's ability to find that patient's pupil. So I would definitely confirm the patient's positioning is correct if the camera's having difficulty locating their eye.
Also, I've seen some patients where they try to turn their head towards the where the camera's going, and that actually changes the angle. So you want them to be square and centered and looking forward and let the camera make the adjustments. The other thing with desktops, you not only do you have the lens, but you have there should be little glass spots, and that is the camera computer able to focus on the eye and center it. So sometimes, like as people talk, they can kind of spit on those portions. If they get a little dirty, then that's where it can stop. The camera can have struggle to find the eye if those little things. So like one camera, it's a little red glass. Another camera looks like a little kind of a goldish glass, but anytime you do a deep cleaning with your lens, clean those as well, okay? Make sure those are very clean because you don't want anything interfering with the camera's ability to focus on the eye and find it.
Absolutely. Those sensors are an often overlooked item for sure. So those are just a few suggestions. If you continue to get that error message and you'd like to contact us directly, our help desk can help you troubleshoot. And they can, if you're not sure where those sensors are located, we can help you find them and kind of give you some more in-depth information. So, and I'll just use this opportunity to highlight anytime you're running into any issues at all, please contact our help desk. Please reach out to us. Let us assist you. We don't want you to be struggling with anything that's blocking you, that's causing you issues or a barrier to your ability to conduct these exams. So we really mean it when we say that we want you to reach out to us. We are available to help you. All right, couple more questions on dilation drops. So if the patient's dilated with the 0.5% tropicamide, do they need to wear glasses? The answer is it's up to the patient. I've seen a lot of patients who don't really feel like the glasses are necessary because, again, they're not experiencing a significant change in their light sensitivity. So not a requirement in terms of, our viewpoint. Again, if your organization has any sort of direction or guidance around that, follow that. But most organizations I see, they just kind of leave it up to the patient on whether they want to wear sunglasses after they've had dilation drops administered.
Very much optional. So it's like if the patient, you have those as an option for the patient. Ask the patient, hey, I do have sunglasses. Do you need them? If you do, pass them out. If not, it's not required unless your specific company says it's required.
Absolutely. Same thing goes kind of for the next question. This user is asking about the expiration date of the drops. Is it the manufacturer date or is it 28 days after opening? So the manufacturer date is the date that most of our organizations go on from before the drops are opened. Once the drops are opened, we kind of see a couple of different ways that organizations choose to handle it. Because the bottles are large, some organizations, they will use them as multi-use bottles with, a discard 28 days after opening. So they would reference the manufacturer date before the bottle was opened. And then once the bottle's opened, they would 28 days. I've seen 30 days as well. And then they would discard the bottle after that date. Some organizations do not use those bottles as multi-use. They use them as single use. So again, I would consult your organization's protocol on what they want you to do with those dilation drops once the bottle is opened, because it may be different depending on the organization that you work for. All right. This one, also not necessarily just about dilation, but a workflow question that may be helpful for us to address. It's asking about where the patient needs to look during the exam. Do they need to look to the right? Do they need to look to the left? Do they need to look at the dot? Where do they need to look? The answer is going to be different depending on the camera that you're using, but there's always a very specific location. The majority of the devices that our clients use have an internal light. There is a light or an X or a square inside the camera that the patient is going to focus on. And that is where we want the patient to look during the exam. There is one camera that some of our clients are using that has an external fixation. So there's a rod, it's a handheld device. There's a rod on that camera that moves around, and there's a dot on that rod. The patient should be looking at that dot, that glow in the dark dot during the exam. So it is going to be specific to your camera, but it should be a very specific location. We don't want them to just look generally to the left or generally to the right or up or down. We want them focused on the specific place. And again, that's going to depend on the camera type, but you're going to be offering them that guidance during your explanation of the exam. There's a small blinking light in this camera. There's a green X in this camera, whatever's in your camera, right? We want the patient to be looking at that. Some handheld devices, they require us to change where the light is blinking during the exam. So if your camera requires that, you want to make sure that you have an understanding of that as well. Most handheld devices, we want the patient to cover their other eye to help them focus on that blinking light inside the camera. The exception to this would be if your camera has that external fixation, right? Because they're looking at that with their other eye, so we don't want them to cover it up. And again, if you have more specific questions regarding your particular device, please don't hesitate to reach out to us so that we can address those based on your camera and workflow.
Just remember, if your patient isn't looking at the fixation dot, your anatomy is going to be wrong because they're not staring where they need to stare, because the whole idea of the fixation is if they're looking at it, then when you get to the photo and you have the anatomy should be in the right location, because the patient was set up. That's how the camera's designed, is your patient is staring at that fixation and we're getting the correct anatomy in our actual photo. If they look anywhere else, that anatomy, we're going to be losing some or cutting it off or what have you, and we're going to lose that information, and the grader might not be able to grade that eye without that additional information.
Such great questions. Thank you all so much. And we always say, especially during training, if you have this question, chances are there's at least one other person who does, if not more. So I really appreciate all of you bringing your questions to us. We are getting close to the top of the hour. I don't see any additional questions in the Q&A box. So this is your chance. If you haven't asked it and you would like to, feel free to drop it in that box before we conclude the session. And again, I just want to reiterate how grateful we are that you joined us today. I hope that these sessions continue to be helpful to you as we try to support you in your ongoing efforts. If you didn't ask a question today and you think of it later, just to reiterate, we are here to help you. Our help desk is very responsive. They are, willing and able to assist you with any questions that you have. Nothing makes me sadder than to go do a training or a refresher, and I find that they've been having difficulties and they didn't think they could reach out to us. So we're very sincere in our desire to help and to support you in your efforts and to address any questions or challenges that you're facing. We did record this session. We will be including the recording in our newsletter for December. We also have all of our webinars on YouTube, so we include a link to our webinar playlist in our newsletter so you can access them at any time. So if you've been distracted at all during the session, if you've been called away, because obviously you're all very, very busy, and we do know that, you are able to access this recording at a later time, or you can share it with your coworkers. All right, got a question. So if the user wants to know if someone is leveraging the mask over the patient's eyes before image capture, the question is how long would they wait before taking the photo? And like Corey and I talked about, typically when you darken the environment or you introduce some sort of assistance to help with getting those eyes naturally dilated, it doesn't take very long to take effect. So if you've got someone wearing, like a dark mask, I'd probably have them wear it for maybe like a minute. And then when they take it off, I'd have them keep their eyes closed until I'm really like about ready to take the photo. So anything we can do to prolong that period before we take the photo. But I wouldn't necessarily have them sit for a really extended period of time with the mask on, because that likely won't impact their dilation very significantly after the first like 30 seconds to a minute.
And like if you're going into a home and that's like one of the things you're using that tool to help with dilation, if you have some questions you want to ask them, you need to talk to them before that they don't have to look at a sheet or anything. You could ask them those questions, why that's happening, why they're doing that, right? It's not affecting them or anything, and they're just answering the questions, talking to you, but dilation is taking place. So, if you can compound some things, that's why I always say, hey, talk to your patients in the dark room because you're making them more comfortable, but also dilation is taking place. So if that's something that can help you and you have some questions you can ask before you get started, do that while they're in the mask. And then whenever you're ready, hey, let's take the mask off and get going, So you have ways to kind of taking your time with that and not rushing it, but you're also doing something else to, move your exam forward.
Absolutely. If you are an in-home operator and you have the option to try to perform the exam near the beginning of your visit, that can also be helpful, because if you identify they have small pupils, like Corey said, you can compound your efforts, right? Have them wear that mask or keep their eyes closed or wear sunglasses while you perform other tasks, and then try to perform the exam again later if they do have those smaller pupils.
Absolutely.
So one of my jokes when I do training, the good news about the workflow is it's totally customizable. The challenge about the workflow is that it's totally customizable. So you may find that you take different approaches depending on the setting in which you're performing exams or how the flow goes. Some of our primary care clinics, they try to perform the exam at the beginning of the visit. Some do it at the end. There's no right or wrong answer. It really does boil down to what works best for you. We're just here to offer helpful suggestions and tools that you can put in your tool belt.
Yeah. We always say we don't care how you get there, but as long as the end result is what we need, doesn't matter.
Absolutely. And
We,
remember, perfection is never the goal. We just want to address those issues that we can so that we can get the highest quality images possible. Dilation is one of those more challenging things because you can only get a patient's pupil so big, especially if you're only using natural dilation techniques. So while there are other things that are completely in our control, like a dirty lens, dilation is one of those things that, you do have kind of a more limited control over. All right. I don't see any other questions so far. Oh, I do see one more about the focus wheel. I think that is specific to one of our camera types. So I will reach out to that operator individually to address that issue. And again, I thank you all so much for being with us today. We really do appreciate your time and all of your efforts. We do know that you have a lot going on and a lot in your day to day. And we just want you to know that this is making a really big difference on your patients. What you do every day with this exam is helping save people's eyesight. And that's a very real impact that you're having. And we really do appreciate all that you do. So don't hesitate to reach out to us if you have questions. I'll follow up on anything specific in the Q&A. And thank you again for joining us.
thank you.
Have a great day, everyone.
Happy Thanksgiving.